Hi everyone, Charles Samugabo here from Makere University School of Public Health. I'll talk to you about our work on perspectives of urban slum youths on health risks in their environment that was done in Kampala, Uganda. So we carried out this work to explore urban health risks that fall short of the planetary health boundaries among urban slums. And we had 10 youths that we trained to take photos on urban health risks, but also trained them on camera use and ethics of photography. Then we gave them cameras to take photos for 2.5 weeks. And during that period, we used to meet every 2 weeks to discuss the photos and generate a data set that we analyze using thematic content analysis with the guide of Kate Route's donut economic model. And so from that, we found that there were a couple of risks that fell below the social foundation, and these compromised the lives of the slum dwellers, and these included indiscriminate disposal of solid waste and liquid waste that resulted into environmental degradation, as well as poor food hygiene and safety that could expose people to food-related illnesses. There was also poor physical infrastructure that resulted into overcrowding and increasing the risks of transmission of diseases. Unsafe sexual practices where people have multiple sexual partners but don't use condoms, and this increases their chances of contracting diseases, and unsafe environments that resulted into high crime rates and violence, undesirable working conditions that including people working in environments that expose them to dust and mosquito injuries, and this could as well affect their lives. But there are also those risks that exceeded the ecological ceiling, like land conversion, where people settle in slums and in swamps, and this puts them at risk of flooding and consequently drowning. And in fact, there have been some deaths as a result of that, especially of young kids, but also pollution from traffic and the sources of energy used for cooking food that affect their health, and consequently climate change. So from this work, we found this work keen and to discuss the causes that force them undesirable situations below the planetary health expectations, and that them living in swamp areas and using biomedic causes them to adverse health risks while degrading the environment. And as such, there is need to ensure that areas are adequately planned. Thank you.